The Narok Senator Ledama Olekina has issued a bad morning statement that has sent William Ruto and his camp in panic. Welcome to Kenyan Media, where we bring you news updates as they break. And kindly, if you're new here, consider subscribing. Now, the High Court in Nairobi has temporarily stopped the Kenyan government from establishing an Ebola quarantine and treatment facility linked to the United States pending the hearing of the constitutional petition filed by the Katiba Institute. The court order comes amid rising public concern and sharp political criticism after reports emerged that the facility could be used to handle Americans exposed to Ebola virus during the ongoing outbreak in the Democratic Republic of Congo. Among the leaders raising questions is Narok Senator Ledama Olekina, who has openly challenged the move, questioning why Kenya could be considered a treatment destination for Ebola-exposed patients from the United States. The issue has rapidly grown from the public health discussion into a wider national conversation about sovereignty, healthcare preparedness, and also public trust. At the center of the matter is a proposed Ebola quarantine facility reportedly linked to cooperation between the Kenyan government and the United States administration. The facility was expected to host Americans considered exposed to the Ebola virus, as well as those believed to be at risk of infection during the outbreak currently affecting parts of the Democratic Republic of Congo. But before the plans could move forward, the court stepped in. At the Milimani High Court in Nairobi, Lady Justice Nyaundi Patricia issued conservatory orders temporarily stopping the government from establishing or approving an Ebola quarantine isolation or treatment facility connected to the United States or any foreign government until the case before the court is heard and determined. The ruling followed a petition filed at the Katiba Institute, and the Constitutional Rights Organization moved to court seeking orders against Attorney General Dorcas Oduor and also Health Cabinet Secretary Aden Duale. The petition questions the legality, transparency, and the implications of setting up such a facility inside Kenya. In her ruling, Justice Nyaundi stated that the respondents were restrained from facilitating, approving, or permitting the establishment and operation of an Ebola exposure, quarantine, isolation, and also treatment facility connected to arrangements involving the United States or any other foreign government. The court order remains to force pending the inter-parties hearing of the application. The ruling has now intensified public attention on a matter that had already sparked political debate online and across the country. Narok Senator Ledama Olekina was among the first national leaders to publicly react after reports about the proposed facility emerged, and in a statement posted on his X account on Friday, May 29, 2026, the senator questioned why Kenya was being considered for such a sensitive medical role. Olekina expressed concern about the possibility of Ebola-exposed patients from the United States being brought into the Kenya and government for treatment. The senator also questioned whether Kenya possesses the level of healthcare preparedness and medical infrastructure necessary to manage such a highly infectious disease safely. His comments reflected concerns already being discussed by many Kenyans online, and the questions have centered on the country's healthcare capacity, disease surveillance systems, emergency preparedness, and whether ordinary Kenyans were adequately informed about the reported plans. Others have also raised questions and fears about possible risks to healthcare workers and also nearby communities if such a facility were to be operationalized. Ebola remains one of the world's most feared viral diseases. The virus is highly infectious and often fatal if not detected and also managed early. Outbreaks have historically caused fear across borders because of the speed at which infections can spread in areas with weak healthcare systems. The Democratic Republic of Congo has experienced several Ebola outbreaks over the years and placing pressure on regional health systems and international response agencies. And according to reports cited in the ongoing debate, the proposed Kenya-based facility could support Americans stationed or operating with the affected region. The arrangement reportedly involved the deployment of U.S. public health officers to Kenya to help staff the quarantine center, or to help staff the quarantine center. Some members of the United States Public Health Service Commission (COPS) had reportedly received notices regarding possible deployment. The commissioned COPS is a uniformed service operating under the U.S. Department of Health and Human Services. Its officers are often involved in emergency public health responses, disease containment efforts, and also medical crisis operations. Still, the reports have triggered difficult questions inside Kenya. Critics argue that the country's own healthcare systems continue to face major challenges, including shortages of medical equipment, understaffing, inadequate emergency facilities, and recurring concerns about access to healthcare in rural areas. For many citizens, the debate is no longer only about Ebola. It is also about priorities, and there are growing calls for the government to first strengthen local hospitals, disease response systems, and also healthcare services for ordinary Kenyans before entering into sensitive international health arrangements. The issue has also renewed conversations about transparency in a government agreement involving foreign powers. Several observers are now demanding clearer public communication about the nature of the reported arrangement, the safeguards that could be put in place, and whether Parliament or relevant public institutions were consulted. At the same time, health experts continue to emphasize the importance of regional cooperation during disease outbreaks, and global public health emergencies often require countries to work together to contain infections before they spread further. Kenya has previously played important roles in regional medical coordination, disease surveillance, and also humanitarian operations because of its strategic position in East Africa. However, public confidence remains a key factor in handling any health agency and emergency. Without clear communication and public trust, even legitimate health interventions can quickly become politically sensitive. That appears to be the challenge now facing the Kenyan government, and the court's temporary suspension has effectively paused the process, and at least for now. Attention now shifts to the upcoming court hearings, where the government is expected to respond to the constitutional concerns raised by the Katiba Institute, and the case could ultimately determine whether Kenya proceeds with the reported Ebola facility plans or whether the proposal is permanently blocked. Meanwhile, the political pressure surrounding the issue continues to grow. Senator Ledama Olekina's remarks have amplified wider national anxieties about whether Kenya risks becoming a destination for managing foreign medical emergencies, while local healthcare concerns remain unresolved. His comments also touch on a deeper public concern about equality in global health systems, and for some Kenyans, the proposal raises difficult questions about why a wealthy nation could seek treatment arrangement abroad rather than within its own borders. Others, however, argue that international medical cooperation is common during the complex outbreaks and should not automatically be viewed with suspicion. What remains clear is that Ebola continues to carry enormous psychological and social fear because of its deadly history, and even the suggestion of the quarantine facility is enough to trigger public alarm, especially in countries where healthcare systems already face significant pressure. For healthcare workers in Kenya, the discussion also highlights the dangerous realities of frontline medical response. Managing Ebola requires specialized training, advanced protective equipment, and also strict isolation systems and continuous monitoring. Any weaknesses in those systems can place medical personnel and communities at serious risk. And as the legal battle unfolds, many Kenyans are now waiting for answers about safety, answers about preparedness, and answers about whether the country's healthcare system is ready for responsibilities tied to one of the world's deadliest diseases. For now, the High Court ruling has placed a temporary barrier before the proposed plans, but the debate it has triggered is unlikely to end soon, and because beyond the legal documents and political statements lies a larger national concern and national question about trust, preparedness, and the value placed on public health. And as Kenya weighs its role in the world facing growing health emergencies, one reality remains clear: that in matters of disease, public confidence can be just as important as medicine itself. That is all for today from Kenya Lens Media, where we bring you news updates as they break. And kindly, if you are new here, consider subscribing, liking, and sharing our content. Hit the notification bell so that you can be receiving notifications each and every time we bring you a new